Okay, in this session we're going to look at coding survey questions. The first question, so we're going to look at three questions. The first question is, during the past 12 months, how many times have you consulted with a general practitioner in relation to your own health? Okay, we're going to name this variable doctor. Okay, you can choose whatever variable name you want. It's generally a good idea to choose one that will mean something to you, which has meaning when you're looking at your data set. The level of measurement here is ratio. Okay, so that if somebody who answers 10, we can say that they attend their GP twice as many times as somebody who answers 5 times. Okay, in terms of the coding rules then, well, this is an open-ended question, but it actually requires a number. So we can code it in line with the numerical values that are returned in the answer. Okay, so therefore if somebody answers 1 visit, we code it as 1. If somebody answers 2 visits, we code it as 2. And if they answer 22 visits, we code it as 22, and so on. Just make note as well that we have the missing values here. So we have a note at the end of our coding book that all missing values are to be coded with a full stop. Okay, so the codes for this question, the numerical values here are the codes. They actually correspond with the numerical values in the answer. Okay, the next question here is a categorical question. So are you currently on a waiting list for any of the following? And there's 3 types in terms of the types of waiting lists. So are you on a waiting list for an outpatient visit? Are you on a waiting list for an inpatient admission? Are you on a waiting list for a daycare procedure or investigation? Or are you on a waiting list for none of the above? Okay, and you can see here that the respondent is told to tick as many as apply. Okay, so this question needs a little bit more thought. Okay, we could have a respondent who ticks yes to one of these, or who ticks yes to 2 of them or to 3 of them. Okay, and we will also have respondents who tick 4, so they're not on a waiting list for any. Okay, so we have a number of variables that we can work with here, and I'm going to talk about 4 of them, and probably the 4 that are the most apparent and a starting point in terms of coding this question. Okay, so what we're going to do first is, in terms of the first 3 types of waiting lists categories that a person can tick, we're going to create nominal variables here. Okay, so they're going to be coded as 1 if the person ticks yes, and coded as 0 if they don't tick this one. So we're taking that as a no. Okay, so these are nominal variables. They're just categories. They're not ranked in any way. Okay, we can name the variables whatever we want. So for the first one, we're going to call it outpatient. For the second one, inpatient, and for the third one, daycare. Okay, and again, these should be categories, or these should be names that are meaningful in some way, and ideally meaningful to you, the researcher. Okay, finally, we may have some people who have ticked no here. Okay, and we want to capture that as well. Okay, so we're going to create a variable waitlist. This is also going to be a nominal variable, but what we're going to do is anyone who has ticked 1, 2, or 3, or has ticked any combination of these options, okay, we're going to code them as 1. So basically, anyone who has a 1 in the outpatient variable, or and a 1 in the inpatient variable, or and a 1 in the daycare variable, we're going to code that as 1. And if they tick the box here for no, we're going to code that as 0. Okay, so you can see that although there's just one question here, there are a number of variables straight away that need to be coded. And then you might go on and code other variables based on your research question and what kind of analysis that you want to do. Okay, the last question that we're going to look at here is this question that looks at the length of time in terms of the appointment time. So this would relate to anyone who ticked yes to the outpatient attendance. Okay, so from the time your GP referred you for an outpatient attendance, how long have you been waiting for the appointment? And you can see there is 6 categories here, going from less than 1 month to 12 months or more. Okay, we're going to name this variable wait time. Okay, and we're going to code it like this. So less than 1 month will be equal to 1, 1 to 3 months will be equal to 2, and so on until we have 12 plus months, which is equal to 6. Okay, this variable is ordinal. Okay, we have categories. The codes refer to the particular categories, but the codes don't in themselves have a numerical value in the way that this variable up here did, this ratio variable. Okay, so it's ordinal in nature. Okay, so somebody who ticks 12 plus months, they're waiting longer than somebody who ticks 3 to 6 months, but we can't actually compute a ratio because the categories are actually time brackets, okay, and they're not specific times. Okay, and again, just to draw your attention to the need to make sure that you have further information in terms of missing values and that they're coded consistently throughout the data set.